Why are women still dying in 2025? Every minute, 2 women die due to maternal health complications. Hello, everyone. Welcome to our Mother's Health Podcast. And this is a podcast where we share the hidden stories behind the global maternal death crisis. I'm your host. I'm Dr. Viviane Chinwah. I'm a mother, an advocate, and a global health educator. In this first episode, we ask the difficult but very necessary question. And it goes like this. Why are mothers dying in 2025? Despite advancement in medicine, despite advancement in technology, in policies, publications, research, advancement in practices, healthcare practices, why are women still dying in 2025? According to the Global Health Report, every minute, 2 women die due to maternal health complications. And these are not just statistics. These are people. These are lives. These are our mothers, our sisters, our daughters, our friends. In 2025, I believe preventable deaths shouldn't be happening in our world today. In this first episode, I set the stage to discuss the causes of maternal death globally. And we'll be sharing stories of issues globally, starting from Nigeria to Haiti, even to the United States and the United Kingdom. We'll look into the reasons and the causes of this death, socioeconomic factors, socio-structural factors contributing to death globally. A whopping 287,000 women died in 2020, according to the reports. These are unacceptable rates of death. And I believe these statistics are even more, considering some deaths are underreported, not reported in some countries because the reporting systems are very poor. So I believe these statistics are even more globally. And I believe that something needs to be done to address these deaths across the globe. We'll look at culture, we'll look at race, and how these factors are contributing to death among women. As we look at these issues, we're going to look at them under 3 categories. 1, delays in seeking health care, which is a very important topic. Delays in reaching appropriate healthcare facility. And 3, delays in getting appropriate treatment. You know, some of the women get to these centers, but they don't get appropriate treatment. Others do not seek healthcare at all. And others, in the bid to get themselves to these facilities, they pass on their way. We're going to share all of these stories, and we're going to invite health experts, people that are knowledgeable in maternal health, to share some of these problems and share ways we can tackle these issues globally. We are trying to throw some light to show this problem and try to discuss how to address them. Although there's been some efforts to reduce global maternal deaths and mortality, in 2023, the death rate dropped to 260,000 deaths. However, a huge percentage, a whopping 92% of death occurred in African countries, in Africa and South Asian countries. And this is concerning. And when we look at the disparities between developed countries and underdeveloped countries, it calls for some measures to be taken, urgent, drastic measures. We look at the maternal mortality ratios. For developed countries, this is 10 deaths per 100,000 lives. When we compare that to developing countries, we're looking at 146 deaths per 100,000 live births. And this is unacceptable. And this has also led to the Sustainable Development Goal and agenda to reduce these numbers to 7 deaths per 100,000 live births. Although these are still very significant numbers, but the global community have set this agenda to try to improve the global outcomes for women. And do we think that this Sustainable Development Goal will be achieved in 2030? I'm skeptical. I'm really skeptical, considering some of the global issues we're having. We had COVID and we had a lot of issues globally. We have the inflation rates and a lot of things happening, the wars, and I'm really skeptical. But can something be done? Can we make some significant progress? Yes, we can. If measures are taken to, strategies and measures are taken to reduce the death of women globally. And when we think about maternal death, it's so heartbreaking, really, really heartbreaking. One, because when a mom dies, the children suffer. It affects the economy of the family. And women contribute significantly to the economy of any nation. So the death of a mother, it influences the family, it influences the children, it influences any nation. So this is something we should take seriously to tackle. I appeal to governments around the world, appeal to healthcare providers, appeal to practitioners and policymakers to take healthcare for women seriously, especially in low-income countries. I think we can all come together to make our inputs, make our voices heard, develop strategies, look at those research again, look at our practices, and take some steps towards improving maternal outcome for women globally. And I dare to say, maternal death is not just about the number. It's about gender. It's about culture. It's about power. It's about systemic issues that must be addressed. I'll tell you a little story about Veronica. Veronica is a woman that died in Nigeria. She had a baby in the village and died from postpartum hemorrhage in the bid to seek medical care. United States, Black women are 3 times more likely to die due to maternal deaths, pregnancy-related complications. These stories are unfortunately layered with systemic neglect, racism, traditional beliefs and culture, religion. I dare to talk about religion and culture and its impact on maternal outcomes. Lack of emergency response. I think maternal mortality should be addressed. It should be urgent. It should be on the front page of every national agenda in low-income countries. We should take this seriously. In this podcast, we will bring you personal stories, frontline account, part interviews. You will hear from midwives, doctors, grieving families, and global health leaders. From teenage pregnancies, blood shortages, to male gatekeeping and disrespectful care. Thank you for joining this podcast today. And I can assure you, a lot of very interesting episodes are coming up. Do connect with me, subscribe, leave a review, share the podcast with someone who needs it. If you fall into the categories of health experts, mothers, you want to share your stories, you want to throw light on this issue, you have an approach or an agenda in your own practice or a standard operating procedure that you would love to share on this podcast, please contact me. I'll be leaving my email at the end of this podcast, send me an email, connect with me, send me a message, and I'll get back to you. Come share your stories. Come interact on this podcast. So follow our Mother's Health podcast on Facebook, on Instagram, on YouTube, on Apple, and on Spotify. I look forward to having a very interactive and nice time on the podcast. Do join us for the next episode. Thank you for coming on this journey with me. It's our first podcast. I hope you enjoyed it. And I look forward to seeing you again on the next episode. Till next time, stay safe, stay informed, and remember, every mother matters. Bye-bye. On our next episode, we'll look at postpartum hemorrhage. Postpartum hemorrhage remains the leading cause of maternal deaths. In 2020, Nigeria recorded over 82,000 deaths causes due to postpartum hemorrhage.
The fact is, right now, a lot of births are still happening outside the hospital setting. How would we address some of the myths or some of the inaccuracies or, the challenges? What are the barriers? How do we include, for example, faith-based organizations? How do we strengthen those partnerships? How do we do the campaign and education in a way to say, look, if mothers are coming to you for birth, tell them to go to the hospital?
Start by saying that to call on the government and policymakers to understand that doing whitewash big hospitals does not necessarily translate to improve healthcare delivery. This is a problem. We have women dying of preventable bleeding after birth.
I think one thing I really like to see more from our politicians and policymakers is empathy.
I would just want to use this opportunity to plead with politicians and leaders of people holding political power that if you will play politics with anything, please do not play politics with health, because the life of humans do not have a duplicate.